Hi, welcome to Step Strides. Me, Connor Ratcliffe, and we're back in the garage gym today, looking at some potential loading strategies for our calf, Achilles, and plantar fascia. Now, today's exercise is probably a little bit more towards calf Achilles than plantar fascia, because we're not really going to be getting our digital dorsiflexion today, but we will still put some load through it. Today's exercise is an isometric hold. So this is a really easy exercise in terms of setup at least, but typically when we use this is a bit more of a regression, and when we've got intolerance to sort of isotonic movement, so concentric or eccentric movement through range. And usually isometric exercise and isometric holds are considered slightly easier in terms of the kind of contraction that we get, but they're a nice first phase of loading, and sometimes you might use these as sort of lower load strategies to start to desensitize or to induce hypoalgesia, so to reduce pain. And actually all exercise kind of has that effect a little bit, as long as it's tolerable and appropriate in terms of your therapeutic range and your patient. So all we need today is a step, and I've got a towel again, my handy towel, and that's really just to mitigate load under forefoot when I'm doing this. And you can actually do this at any range of motion, but we'll start just with perpendicular, and that's usually the position that I'll do this in, but we can do this in sort of end range, so a shortened position and plantar flexed, or we can drop down into slightly sort of dorsiflexed position of foot relative to leg to put a little bit of stretch on our calf and our Achilles, and then hold in that isometric contraction. So let's have a look at it. This is going to be our start position. So for our isometric hold, all we're having to do is just hold in this position. Now, if I wasn't getting contraction, I'll drop down. So we know we're getting that isometric contraction through our posterior compartment, and it'll hit everything in posterior compartment, but primarily we're looking at this for gastrocnemius soleus and our Achilles tendon. Now, as we mentioned, you can do this in any position, so it might be that they're more comfortable into end range plantar flexion, and you could do this obviously without a step, just on flat ground, but the point of this is that we're then holding for time rather than working through active range. And likewise, just to demonstrate that, down into dorsiflexion relative to leg, we can hold into a bit of dorsiflexion, or we can come back to that more perpendicular position. And all of this is going to be based on your patient, their tolerance, and what you're trying to achieve. And that's our isometric hold for our calf muscle complex and our Achilles.